What is lipedema?
Well, lipedema is a chronic condition that affects mainly women. And you recognize it as an uneven deposition of fatty tissue.
Mm-hmm.
Very often, but not always, the top part of the body will be smaller than the lower part of the body. So the hips will be big. There could be cuffs on the arms, cuffs on the legs, as you were talking about before. And unlike regular fat, lipedema fat does not respond in a regular way to regular exercise and diet. And it's very painful. We know that there is a genetic component. We also know that estrogen plays a role, which, as you were saying, it manifests usually at times of hormonal changes. Mm-hmm. Can be puberty, can be pregnancy, can be hormonal changes and problems, and then menopause. So the exact pathophysiology of lipedema is not known yet, but we're learning more and more. We do know that there is a lot of inflammation. Many of the patients are overweight, and there also can be lipedema with obesity, and women are very frustrated, and it can really affect the emotions.
To answer the question, what causes lipedema? We do not know. We do not understand that etiology, that pathophysiology, but what we are actively learning are the different contributors, the different triggers, the different areas
Correct.
And the manifestations of this condition, but still we do not know the true etiology of this.
That is correct. We know that there's an inflammatory response, so there's inflammation. We even know that there are macrophages that are there and a lot of inflammatory cytokines. We know we're learning more and more through research, but the exact pathophysiology, it's unfolding. I get research almost every week, some new research that's coming.
Lots of information. And how does someone know if they have lipedema?
If a woman, and it's largely a woman's disease, and if a woman is dieting and exercising, as I did when I was younger, and there are areas that are just not going away, the legs look heavy, they feel heavy, there's pain, and it's just not going away, and they're doing everything. And if they have that cuff, which could be in the arm or the legs, there could be a sign that there is something more. I didn't know what was wrong with me because I was exercising and dieting and these legs were still heavy.
Why would you say that is so often mistaken or so often misdiagnosed, either for simple weight gain or even sometimes obesity? And what impact that generates on the patient?
That's a really good question because many patients are overweight or obese in different stages. And the doctors do not know. Most of the doctors, we're trying to educate everybody, but most of the doctors don't know that there is such a thing as lipedema. Mm-hmm. So they look at the patient and say, oh my goodness, you're overweight. And they may be obesity in addition to the lipedema. And then the doctor just says to them, you need to lose weight, you need to exercise more. Well, the patient's been doing that for so long. So it's very frustrating. They can get depressed. They feel that they are not heard. And we hear that every single day. So we need to create more of an awareness. So the patients then feel it's their fault and they feel very ashamed. So we need to understand the difference between obesity and lipedema. And actually, what's been researched, the fat looks completely different to obesity fat.